We didn't know at first what had happened to him. All we knew was that the policeman arrived at the door and said, "Are you the owner of K798XBM?" Which we were, and immediately we knew this was a very serious problem. So he drove into the back of a lorry on the M25. We don't know why, because that part of the motorway there were no cameras. So a complete mystery on that one.
We were told he wouldn't live the weekend, and we were asked to consider turning off the life support machine, and it was all too much of a shock at the time, and I couldn't have made any decision. I was completely shell-shocked.
Without a home that BIRT provide, Rupert would be at home with the family. So if it wasn't for BIRT, our family, we wouldn't have coped if Rupert was at home living with us full time, and so the care they provide is outstanding.
The Disabilities Trust had already been established by Norman Thodey, the original chief executive of the trust, to accommodate people who had a physical disability, and it became apparent fairly soon after that that a number of the people in those services had actually got an acquired brain injury and needed a different type of service to the one that they were being offered.
Well, the initial challenges were actually to try to persuade people that the neurobehavioural model of rehabilitation worked. And I know people like Colin Headley and Roger Wood, who was our first clinical director, worked tirelessly with other clinicians and commissioners and other influencers to ensure that they were aware of the good that the neurobehavioural model could bring and the difference it could make to people's lives.
I was one of the first clients here, yeah. And there's only one or two here then, and then it developed from there. I worked 2 days a week in Jimmy's, in the cafeteria, kind of so smart, it's like a restaurant, you know, after Jimmy Savile. So that's a clean job placement, and also I worked one day at the library trolley pushing the books round.
Well, we're all hugely proud of the services we have. The environments that we maintain, they're all at a very high level. They are built specifically for the individuals that we serve. We often go to areas because we've been asked to by local health professionals. We build the buildings to match the service users, and we build the staff teams to match the service users. We have a highly committed, dedicated staff team that are fantastic.
We're now only being referred the very complex people, and the people who first came into our services perhaps wouldn't actually receive our services today because some of the commissioners wouldn't recognise the good that BIRT could do for them.
Gould is a partnership with the NHS, and people there are much closer to the trauma and the incident than we would ever have had previously. And they can come in there and the rehab can start at that moment in time, which we've never managed to do.
My admission to Daniel Yoworth House was after my 15th admission to hospital with seizures brought on by the brain injury I'd incurred. Daniel Yoworth House was very welcoming, efficient, but at the same time homely.
It's a business that makes me stay awake at night sort of worrying about things, particularly with the upcoming cuts in funding that we know are going to be coming. It is going to be quite challenging, we have no doubts about that. And I think it will be challenging particularly for the most complex people who may not get the appropriate services that they really require. We have research that indicates and shows very, very clearly that we can save up to £1 million in care costs for one individual should they come into our service less than 1 year post-injury. And we're also hoping that many of the people we support can go back into work. So therefore, they're playing a full part in society and paying taxes.
We're all very committed to what we do, and we enjoy it. And we just get a lot out of it because of the success we have, and I think for us that's absolutely what it's all about, and hopefully it always will be.
It's important to feel that there is a space and a place and a home for people with acquired brain injuries. There's not enough, and what BIRT do is fantastic.
It's unbelievable for me to visit all our services and see people that I've known for years and years, and see the difference in them. From an acorn, an oak tree, and a mighty oak tree has actually grown. And I'm not only proud, it makes the hair stand up on the back of my neck to actually see the difference that we have made to so many people's lives, and believe me, we have.